Let's look at all of the steps we do before we start our phlebotomy procedure. It starts with confirming the patient, checking our requisition form, and organizing the proper supplies. Before starting a phlebotomy procedure, it is important to identify your patient and perform a patient intake and interview. We also need to make sure the requisition form is in order before taking any blood from the patient. Before you start, we must identify the patient we are performing the venipuncture on. By following the two-identifier rule is essential to ensure patient safety and prevent potentially serious errors. This means you must confirm the patient's identity using at least two unique identifiers, most commonly the full legal name and date of birth. But the medical record number is also widely accepted, especially in hospital settings. For inpatients, always check the wristband for the full name and medical record number or date of birth, and never rely on a room number or chart alone. In outpatient settings where wristbands aren't used, ask the patient to state their full name and date of birth, and request a photo ID such as a driver's license to verify their identity. Engaging the patient to state their information, rather than simply confirming details you read aloud, helps catch mistakes before they happen. It is important to have the patient tell you their name, and not just nod their head to your reading of their information. Older confused patients, or patients with anesthesia, may misidentify themselves if all you use is a nod of the head. These steps are not just best practice, they are mandatory, and skipping them can lead to misidentification, incorrect treatment, or even life-threatening consequences. Here are some effective and safe ways to ask patients for their identification during phlebotomy. Could you please tell me your full name and date of birth? Would you mind spelling your first and last name for me? Can you state your medical record number if you know it? For your safety, may I see your photo ID? What is your full name? Remember, let the patient say it rather than just confirming. Or can you tell me your date of birth? Let's break down the requisition form, what it is, and what it contains. It is one of the most important tools in phlebotomy. This form tells us who the patient is, what tests are being ordered, and any special details we need to know before collecting a sample. It might not look flashy, but it's a big deal. If a form is missing information, like the provider's name, the patient's name and date of birth, or the correct test, proper diagnostic codes, and checking off the tests that need to be completed, it can cause delays, errors, or even lead to the wrong patient getting tested. So part of completing a good phlebotomy procedure is knowing how to spot incomplete forms and make sure everything's accurate before you even pick up a needle. It's all about protecting the patient and making sure the lab has what it needs to do the job right. Once you've got the requisition form in front of you, don't rush. Take a second to double-check everything. Is the patient's info complete? Are the tests clearly marked? Is there a note about fasting or special tubes? This is your chance to catch mistakes before they become problems. Once you've verified everything, it's time to pull your supplies. Look at the tests being ordered and make sure you grab the right tubes, needles, labels, and any extras you might need. Being organized ahead of time means a smoother draw, fewer errors, and a more professional experience for the patient. Before you draw any blood, take a minute to slow down and focus on the patient. Start by checking that the environment is clean, calm, and organized. If possible, position yourself at their level, as standing over someone can feel intimidating. Greet them warmly by their full name and introduce yourself. Hi, and I'll be drawing your blood today. Use a calm, steady tone and make eye contact. If they seem nervous, it's okay to say something like, "It's totally normal to feel a little anxious," and tell them that you will walk you through everything. Always ask permission before touching their arm and pay attention to body language. Clenching the fists or pulling back of the shoulders may mean the patient is anxious or scared. Keep everything respectful, modest, and trauma-aware. Next, move into your patient interview questions. Ask if they've had blood drawn before and if they've ever felt faint or dizzy. Check for any history of bleeding disorders or if they're on blood thinners. You'll also want to ask about fasting. You may state that as, "Have you eaten today?" Or ask if they have any IVs, ports, or a history of surgery that might affect which arm you use. Don't forget to ask the patient about their allergies, especially to latex, adhesives, or antiseptics that may be used during the phlebotomy procedure. Always explain to the patient what's going to happen. This will keep the patient's anxiety low. You might say things like, "I'll clean the area, place a small needle, and collect a few tubes. It should only take a minute." Let them know they should speak up if they feel unwell at any point during the procedure. Offer small choices when you can, like which arm to use, or if they'd like a countdown. Those little moments of control go a long way in helping a patient feel safe. Finally, document or pass along anything important, like a fainting history, or if they prefer a certain position for the draw. Starting the phlebotomy visit correctly is the key to a smooth procedure for you and for your patient.